Hello, everyone, and welcome to a very special episode. It's very simple and very summary. So, hello, summer. We will talk about how to stay safe in summer, what are the precautions, and what are the problems that might cause. But before I proceed further, I would like to welcome my friend and my colleague, Dr. Mariam Aldashti. Hi, Mariam.
Hi, Sundus. How are
We
you?
are
I was
summary.
just going to say that. We were not planning on matching,
Never.
but it just happens to be that we're very summary in a topic today, which is
Because of
staying
the
safe.
chemistry, between our minds.
Yes, absolutely. The chemistry is always there. So I think we are all boiling in this heat wave.
Yeah.
I mean, we're in Kuwait, so it's not technically a heat wave because we're used to it in the summer by now. So I think we are the most, let's say, population that needs to take care in summer.
Exactly, and especially in the summer, we can't wait for it to arrive. I know it's very hot.
I
but
like the winter, honestly.
Me too.
I
I'm a
prefer the
winter person.
yes.
But I like the sea. I like the beach. I like to go and enjoy swimming. And I think many people actually in Kuwait, they do the same thing because it reduces the heat and it reduces the stress of
and it's
the
the
hot weather.
activity to do, honestly, when it comes to summer. Yeah.
You cannot go walking in this hot weather.
Absolutely not.
So swimming is the alternative.
Yeah, absolutely.
And today's episodes, we're going to talk about the problems that might happen in the hot weather, how to have a safe summer experience, especially when we are going to the chalets, swimming pools, enjoying our time. And the problem with the summer, not only in the morning hours, also in the evening, because the heat is still there.
Absolutely.
The problem with the summer, it's not the sun, although S and S, but no, it's about the heat itself. At night, the temperature is still in its 48 and 45, so the heat is still there, and most of the problems that happen because of the hot weather rather than the sun exposure. But I think we're going to cover all of that in today's episode.
Absolutely. And I think heat affects everyone, obviously, but kids sometimes are affected more than adults because adults tend to sometimes stay in the shade. They're more aware of the things they need to do, but kids are kids. They want to play, they want to have fun. So there are some serious effects that can happen. Now, I think we've all seen the news where we see certain countries, they're having heat strokes at temperature of 28, and we laugh, honestly, because 28 for us is still, relatively spring.
Exactly.
It's not summer at all. But I think this goes back to adaptation, human adaptation, where a human adapts to their environment. But that doesn't mean that we don't have to take proper precautions, because heat has major effects, not only visibly, but physically on the human body. So it can be very dangerous.
Mariam, we were in chalet last week, and our housekeeper, it was her first time to enjoy the chalet. So she was swimming, and I told her every time now and then, I tell her, you need to drink plenty of water. And she said, Madam, I already drink. Okay, did you put sunscreen? And I was checking on her every time between now and then, because I know the instructions I already gave to the kids, to the family members, but this is her first time and she's not used to our heat. So I was every time reminding her of the instructions. And then suddenly at night, she started to experience high-grade fever, nausea, vomiting, and she was really scared, dizzy. And I told her,
it was a heat stroke.
That's why I was insisting that you should wear your hat, you should drink plenty of water, because of the heat stroke, and this is what you have. And she said, am I gonna die? I told her, no, this is something normal, because we have a very hot weather, and it can happen even with a small rise in temperature, but precautions needs to be taken in order to prevent the heat stroke, the sunburn, the sunstroke, all of these complications that might happen in the summer.
Absolutely. And I personally experienced it. I'm not sure if you, I hope you didn't, but I personally experienced it. I was traveling, wasn't even in Kuwait. I was traveling into a summer country. So I applied the sunblock. I wasn't feeling the heat, honestly, and it's not even as hot as Kuwait, but I ended up with a sunburn, a first-degree sunburn, and it was extremely painful. I couldn't shower because, you know, any water touching it, even if it's, you know, warm water, and obviously you can't shower in cold water. It was also painful. I couldn't sleep on the sides because the burn was in my arm. So it is, you know, relatively uncomfortable, and you can have swelling in the area, sometimes blistering. So it's not just a tan. No, it actually causes a lot of damage to your skin.
And one of the also complication of summer, and I think we read a lot about it in the news, drowning.
Yes.
Drowning in swimming pool, in the sea, in the beach, all of these might happen as an incident, especially if the person is not supervised. And that's why lifeguards or a supervision by a trained personnel is very important. Don't say that I taught my child how to swim so they are safe. No, don't say that it's a kid's swimming pool so they will not drown. I've seen cases who drowned in the bathtub in the home with small inches of water. So this is really crucial. A supervision needs to be there. And drowning not only happen with kids, but
adults
also with
well.
adults.
Yes, absolutely.
Sometimes if you swim and you have muscle cramp,
or the current, you're against the current and you can't swim back, even if you're a good swimmer.
Exactly. Yes. And you know, two of my brother-in-law family member actually died because of the absorption through the current. And they were excellent swimmers, but they couldn't have the time to push themselves out of this current, and they lost their lives of it. And they are adults. So drowning not only happens in kids, but also in adults. So don't say I'm an adult, I don't need supervision, I know how to swim. A simple muscle cramp can lead to the end of life. So a lifeguard is very important. Supervised trained personnel is also very important.
Absolutely. And let's not forget our favorite thing to mention, hydration or dehydration. I think we need to dedicate an episode for hydration and dehydration and the effect it has on the body, because people might think it's just water, what's the problem? But in reality, it's extremely a condition, or dehydration can really affect your organs in a very negative way. We're going to talk more after the
Did You Know report. Stay tuned. Hello everyone, and welcome to a summary episode. So we will try to make our episode light and breezy in this hot weather, just for the viewers to enjoy and get the benefits from the tips and points that we're going to discuss in today's episode. And we mentioned about many problems that might happen during the summertime in the hot weather, and one of them I would like to mention and insist on mentioning it, which is drowning.
Yes,
drowning is very crucial and life-threatening, and if there is no supervision while the person is swimming, it might lead to serious brain damage and death. Many of the kids, especially as I worked in the emergency department at some point of time, we hated summer as doctors, because we know at the beginning of summer, every day, every other day, we will receive at least one intel about a child who just drowned, whether in the swimming pool, whether at home, or even in the sea. And this is because the people think that I already trained my child, I already trained that person having swimming lesson, then they are protected. On the contrary, I have seen kids who drowned with only few inches of water, especially if it was at home. So supervision is very, very, very important. Don't say that I put my child with the swimming aids and in this kids swimming pool,
because we've seen it where they flip over even with the donut in inflatable, you know, objects, but we see them flip, and then obviously they cannot do anything. They struggle.
Have you tried to come back from a flip donut?
Yes, it's a workout. It's a workout on its own. So
exactly.
Yes,
and as an adult, I couldn't. How about a child who are very thin, very fragile, and very tiny?
Once a human panics, they lose all sense of logic, and they cannot critically think of how do I get myself out of the situation. I mean, we're talking about adults, obviously children, they cannot. But once you panic, then you lose all your legal, your cognitive skills and sense.
Absolutely. You know, as doctors, when we panic, we do the same thing. We forget everything that we learned and we just act as parents.
And this is why one of the rules is doctors are not usually allowed to treat relatives and family members. I mean, we're not talking Panadol, but surgery and something major, because you cannot make clinical judgments, sound clinical judgments. So going back to drowning, there's actually the secondary drowning. And this is also something very important to at least spread awareness, because secondary drowning is where the child has swallowed a lot of water or actually choked on a lot of water. So the water has invaded the alveoli of the lungs. And usually the symptoms don't show immediately. So they can have their dinner, go to sleep, but then, you know, unfortunately pass away during the sleep or go into, you know, a coma or something, because the fluid, the oxygen exchange is occupied by fluid. So this is secondary drowning. And obviously this is also important. So if you're in doubt that your child has swallowed a lot of water or somewhat struggled, then, you know, obviously try to keep an eye on the child, and then, or just visit the emergency room.
Exactly. And always, always, always have a CPR kit ready whenever you are, wherever you go. And I think now most of the malls, restaurants, even chalet, they have a first aid kit. So this is very important. And learn your CPR. CPR for a child and CPR for an adult, because they are different. And I think there are many free courses in our country where you can just Google them, and they will tell you all the places where you can find free CPR for non-healthcare practitioners, where they teach you how to do CPR for drowning, choking, loss of consciousness, convulsion, all of these important things that you need to know.
Yes, absolutely.
If you have a caretaker or caregiver with you, also it's very important to teach them how to do the CPR.
Absolutely.
Because you're not there all the time.
Yes, this is all part of the management, but you know, sometimes they have to spot the signs first. So, you know, if you have a sunburn, like we were saying, that sunburns can be just simple, you know, redness with a little bit of TLC, tender loving care, you know, some aloe vera, they're just topical things, and this can be obviously taken care of. But sunburns is different categories. So you can have the superficial, the first degree, which is very painful, trust me. I mean, I've tried it. The secondary or the second degree burn, where there will be some blisters, and it's extremely painful. And in reality, if these blisters sometimes pop, you're exposing the body to bacteria and, you know, surface bacteria. So it's not something to take lightly, because, you know, sunburn is extremely painful and very common. During the summer, you might not feel the heat, but the UV rays is what's causing the sunburn and the heat stroke. Like, you know, the caregiver in your family, she experienced heat stroke, and this can lead also to serious complication when it comes to hypoxia of the brain as well, because heat stroke, obviously your brain goes into, you know, higher temperature, or the body goes into a higher temperature. Kids sometimes cannot handle it. Young kids cannot handle it. So it can be very dangerous when it comes to a heat stroke. So obviously taking all the precautions, which we will discuss in our next segment, that it is very important, because staying safe this summer is not to be taken lightly when it comes to our bodies and also our young kids.
Exactly. And I always advise my family members and also my patients if they come to me, and I tell them that there are certain special shoes that you can wear, especially if you are going to the beach, just to prevent if you step on any rocks, any broken glasses, because you don't know what's inside
the ocean.
So you might have cellulitis, as we mentioned in previous episode, infection in the skin. There might be also stinges from
stingrays sometimes, or the jellyfish.
Jellyfish, exactly. So even though it is not very poisonous, it is a poison, but it will not
cause a local reaction.
Exactly, and it will cause also cellulitis, because the poison of the jellyfish will go into the skin, and then it will cause inflammation and redness. So you should be prepared and aware how to deal with it, how to manage. People will think that I should try to take it off, wash it off. You put anything acidic on top of it, and we've seen it in one of the famous series where pee can help do the same thing if you don't have vinegar.
Because it has acidity and
exactly
ammonia.
The acidity will help to clear, but the problem was with the urine rather than the vinegar, it's that sometimes it has bacteria, so it will lead to cellulitis. So just be careful. If you have vinegar, just replace it, or you just wash it, rinse it well with water, and it will go away, and then you can take that person to a nearby hospital, and then they can give the management.
Absolutely. And let's not forget dehydration, like we just mentioned briefly. But dehydration, you're not just thirsty, you're actually dehydrating your actual organs, and the blood might change in terms of viscosity. Obviously this is more advanced, but water makes up 70% or even not more than our body, so we need the water content, we need the hydration. And obviously if you're in the heat, you are prone to hydration because you're sweating. Even if you're wet, you will sweat, and this will cause dehydration. Obviously dehydration can lead to serious complications. You can be admitted due to dehydration.
Mariam, people think that as long as I'm inside the water,
I'm safe.
I will not have heatstroke, I will not have sunburn, I will not have dehydration because I'm in water. What will happen? It's the opposite, exactly the opposite. You will have dehydration, you will have heatstroke, and you will have sunburn.
Because you're in the open air, you're exposed to the
you cannot feel
UV
it
rays.
because you're in water. You will not feel the effect of the sun and heat on your body unless you go out of the water in a few hours.
Try to sit outside the water for, let's say, 15 minutes. You cannot handle it. You start to feel extremely hot and you need to cool down. So there is a major effect, but sometimes you're not sensing it, even if you're not in water. If you're going hiking or walking, or obviously different countries, we don't have hiking, but in different countries, it's the same concept. You might think, no, there are trees over me, there's no sun, there's no direct heat, but in reality, we're talking about the rays, the ultraviolet rays, the UV rays, the infrared, all the rays under the sun, metaphorically speaking. So you will be exposed. It doesn't have to be necessarily if you're swimming or if you're in direct contact with the sunlight.
You know, Mariam, you will be surprised. I know many people who already have hiking and walking in winter time. So when they say summer is coming, I have no problem, I will walk the same thing. And the problem is we still encourage, and this is really a good thing they're doing, but the problem, you need to choose your timing. In winter time, if you go at, let's say, 11 o'clock in the morning, the sun still, it's not in direct contact on Earth. So the effect of the sun and the heat will not be direct on you. But in summer, walking 9 o'clock in the morning, it will hit you directly.
Perpendicular.
Exactly. So I think we covered most of the things or the problems that we might face in summer, but now we come to how to manage and prevent them after
the break.
Stay tuned with us. Welcome everyone to a very breezy and summery episode. So I think we talked about the problems that we might face in summer, and now we come to the most important part, which is how to prevent. As we mentioned briefly in the previous program or segment, that to prevent drowning, there should be supervision all the time. You shouldn't sit there and hold your phone or watch TV while listening to the kids. No, you need to observe them directly. Maintain your eyes on the kids, on the people who are swimming. Not only kids, we said even adults, they might drown. So being there, being trained. You shouldn't put a person who is supervising as someone who's swimming and they don't know how to swim. So in case of drowning, how they will extract?
They will drown themselves.
Exactly. So there should be a trained person who is observing the people who are swimming all the time. Lifeguard should be there all the time. First aid kit should be there also. You need to know the CPR in case drowning happens.
This is very important. You mentioned earlier when it comes to the CPR, and I think you're absolutely right.
So it is very important. And don't say that I put a little water so no one will drown. I know many kids who drowned with few inches. So the amount of water that is available does not mean that you are protected or the person is protected. You need to have supervision all the time.
Yes, absolutely. And let's not forget the easiest thing to do, which is apply sunblock. applying and reapplying sunblock is very important and vital. And obviously there are kids safely products and for adults in different levels, but apply and reapply sunblock. And when you come to choosing your bathing suit, choose wisely. Try to have your arms covered as much as possible, because arms and legs, because obviously you're blocking the rays and the effect of the heat on the body, especially if you're wet. But covering up will actually help when it comes to at least the sunburns and the heat strokes. Like you said, wear a hat. I wanted to say an interesting fact. I know we're talking about summer, but because we mentioned sunburn, did you know that people actually can get sunburned even if they're hiking in snow?
Yes.
And this is very common. We don't see it in Kuwait, but we do tend to see those cases, because the way it happens is, although you're in the snow and you're wearing, you know, layers and layers and layers of clothing, but the way the sun reflects off of the snow onto your face will cause sunburn. Believe it or
as
not.
you said, like the ones who are in the swimming pool, because you're feeling cool,
Yes.
you will not feel the effect until few hours
Absolutely.
later.
Yes.
And you mentioned also, Mariam, a valid point about sunscreen. And I have been discussing with my fellow dermatologist regarding the safest degree of SPF. We always read that there is an SPF.
Yes.
And you know what the most of them said? That in Kuwait, for kids, it's better to be 40 and above.
Yes.
For adults, it's better to be 50 and above. Other countries where the sun is not very a direct contact on Earth, the heat is lower than Kuwait, then little bits less SPF is better. But if we continue to have 40 and 50, it's no harm.
It's always better safe to be sorry.
Exactly. And usually we apply it 15 minutes before we go out in the sun. And then, as you mentioned, we reapply it 2 hours after, because after 2 hours, it will be totally absorbed by our skin.
Yes.
So we have to reapply it again, and not only on the face and hands,
yes,
on the whole body.
Yes, absolutely. And also because it's not, like we said, something superficial, because the more you're prone to sunburns and blisters, it actually can increase your risk of cancer or skin cancer.
Yes.
So it's not something that's, you know, it's going to go away. It's just a tan line that will go away. You're actually harming and destroying the barrier of your body and the skin barrier. So it has a major effect. And then again, drink plenty of fluids. Yes. Have your cooler with you. So have your cooler so you can at least keep your fruits and snacks. Obviously, you don't want to keep them in the heat, because this will start to grow bacteria when it comes to certain types of foods, you know, not chips and things which are dry, but, you know, vegetables and fruits. If you keep them out in the heat and in the sun and not store them correctly, you will become sick in different manners. So have a cooler with you where you can apply your hydration objects and mechanisms, so water, juice, whatever it may be. And then obviously to store your food that you're going to be ingesting, because this also can cause you some harm when it comes to the summer.
You know, Mariam, this is what I do actually. I put a big bottle of water, or a big
you freeze it
next to the swimming pool or next to the beach with glasses, ice, and I tell them, how long have you been since you drank your water? You need to drink now. And then what I usually do, and this is really a useful trick, I always bring with me watermelon.
Yes.
Watermelon are rich in water and very excellent in dehydration. So I always cut it and put it in a large plate and tell them, you need to stop swimming, you need to stop whatever you're doing, you just take 1 or 2 pieces and then you go continue. And sometimes they complain that you interrupted our activity and play. And I tell them, no, this is very crucial in order to prevent the dehydration that's going to happen from the heat, and in order to prevent heat stroke and dehydration. So this is very important advice, and just try it with your kids next time.
Yes, absolutely. And when it comes to also heat strokes, again, they are relatively common. You can give, you know, some forehead, just like Yes, hats obviously, but if it does happen, then just apply some compressed, room temperature, not too cold,
Yeah.
compressed towels, and give some medications to reduce the fever, keep them comfortable. Wear cotton clothing, not something that's, itchy and too heavy, because the body needs to vent and release that fever. They will sweat as well. Try to keep them hydrated. So this is the common, let's say, practice when it comes to heat stroke. But obviously, if a person is hallucinating, the fever is extremely high, they're not,
Conscious.
they're unconscious, they're not coherent with you, then you should definitely visit the ER or the hospital, because there are more aggressive and immediate management, let's say.
Exactly. And as you mentioned, this is a very valid point, Mariam, because if a complication happens, whether from drowning, heat stroke, sunburn, and you know that you cannot manage it at home, just don't push yourself
don't wait.
and delay it, because major complication might happen. As we said, drowning, because it will deplete the oxygen supply in the brain.
Absolutely.
So permanent brain damage might happen. The person might be in a coma, might even lead to death. So don't delay it. If it happens, you just call an ambulance. If a clinic is nearby, you just take the person immediately there, whether a child, an adult, or whatever. You take them there. So immediate medical care should be provided at that time. If there is a sunburn, as we said, blisters, then it might lead to infection. Please
do not pop the blisters.
Please, it's a fatal mistake.
Yes, this is a big mistake.
And it's better to go to the hospital where they apply ointments, medications, antibiotics might be taken even orally, and bandage might be applied around it. Jellyfish.
Yes, jellyfish sting. Yes,
exactly. So don't pee.
Yeah.
Use vinegar, but if you don't have, then you have to do it, and take them to the nearest medical center by you, just to prevent the development of cellulitis. And we said in a previous episode that is very dangerous, so it's better to give immediate medical care, and don't wait until you finish your vacation and then go get checked up.
Absolutely. And again, education. Educate your kids, educate your family members, educate your caregivers, at least to manage this entire period of the year when it comes to the summer. So have your sunblocks available, your bathing suits. Obviously, we said hydration, cover. If it's maximum heat, stay inside, avoid the sun, and wait until the sun goes down a little bit, or in the morning, and then you can start swimming, for example, or hiking, or whatever activity you're planning. And take care of elderly, because the elderly are extremely sensitive, and obviously sometimes they have other conditions, so adding onto it is not advisable or warranted for. And overall, because their skin is more sensitive, their overall health condition sometimes is more sensitive. So you don't want to add anything on top of it when it comes to anything related to the summer.
Exactly, Mariam. And I have seen a video that is very interesting on one of the social media for a child helping his sister while she was choking. He was doing the Heimlich maneuver and he was doing CPR for her. And he saved actually her life. So you mentioned a valid point that you as a person, the caretakers at your home, even the kids, you should take a CPR session and
Absolutely.
CPR course.
Yes.
It's not expensive. It's only one-day course, and you get to save a life and your life and your loved one's life. So it's very important. I think we covered most of the points regarding the summer, and I hope it was a simple, breezy episode, and I hope you benefit from our tips and points. We wish you a safe and fun summer, and hope to see you again in a new episode in our program In Sync. You have a good day.
See you next time.